Okay, good afternoon or good day. My name is Christian. I'm from Nigeria, if I am medical student, and I'm strongly of the opinion, and we of the opinion that health system should invest in personalized genomic medicine, and I'm presenting Dr. Esther from Uganda. So, as a way of introduction, personalized genomic medicine uses a person-centric information to guide prevention, diagnosis, and treatment. Investing in personalized genomic medicine is not a luxury, it is a necessity. While we must not neglect basic care, we cannot afford to ignore the future of medicine that promises better outcome, smarter decisions, and more efficient system. It is a diagram that compares conventional system and personalized system. In conventional system, when treatment is being administered to patients, they have serious adverse effect, as you can see on the diagram. There is either low or no efficacy, also on the diagram, and the efficacy is not that good. But with precision medicine, there's the serious and adverse effect is reduced. There's good efficacy when compared to conventional medicine. So you can say that when you can say that genomic medicine or precision medicine is a necessity and it's not a luxury. We are not saying personalized medicine replace the care. Rather, we are saying that health system must be bold enough to do both, invest in genomic medicine, and is how we look forward. As Edgar said, personal genomic medicine uses individual genetic information to prevent, diagnose, and treat more effectively. It helps us to detect cancer before it spreads, choose the right drugs for the patient, and also prevent chronic diseases. It promises fewer side effects and better outcome as smarter delivery. Okay, here goes our constructive arguments. One, it improves health outcome. Personalized or precision medicine improve health outcomes. Here is a case study in Nigeria done in a multi-center study done in Nigeria. The study found that the human epidemial growth factor is responsible for increased growth of cancer cells, account for 22 to 25% of breast cancer in Nigeria. Many patients were misclassified and misdiagnosed due to the lack of HER2 testing. Now, the implication of genomic medicine is if routine HER2 testing is done, incorporated into cancer diagnostics, targeted treatment like F13 will be more accurate and leading to better outcomes. Then our second constructive argument is that it saves costs in the long run. A study conducted by the Harvard Institute partnership. Now, this investigated the prevalence of HLA-B5701 gene, which was linked to severe hypersensitivity to an antiviral agent, which is abacavir. Now, the intervention was that implemented routine screening for HLA-B5701 before prescribing abacavir, help in preventing hypersensitivity reaction. In other words, those that are sensitive to this, that have sensitivity reaction to this drug are given alternative antiretroviral therapy. Now, there is zero incidence of hypersensitivity reaction in screened patients, and this avoided costly hospitalization of about $500 to $1,000 per reaction. This intervention prevented drug switching, it prevented treatment failures, and mortality demonstrated were minimal. The third constructive argument is that personalized or precision medicine enhances and not replaces basic care. It enhances and not replaces basic care. A study in Uganda and Kenya uh, uh, done saw that intervention with personalized or precision medicine, annual population-wide HIV testing was done, regardless of the CD4 count. Now the result is this: viral suppression rate were reduced. In other words, the suppression rate of suppression was from 42 to 79% in intervention. And key point here is this: precision medicine enhanced basic HIV care by enabling faster, more tailored treatments, improving outcomes without replacing foundational healthcare services. Our constructive argument is that it builds research and innovation. There's precision medicine builds research and innovation. Initiative like the Human Hereditary and Health in Africa, which was launched by a couple of bodies, has established over 50 research projects, genomic labs across 13 African countries. The outcome is this: over 400 African scientists were trained, hundreds of publications have been done, and biobanks has been created. Now, the relevance is that it demonstrates how genomics investment grows long-term health infrastructure. Now, our last constructive argument is that investing in precision medicine aligns with global future of medicine. Investing in precision medicine, it aligns with global future of medicine. Now, this is a case study in Africa. The intervention was that researchers implemented genomic sequencing of TB bacteria to identify drug resistance mutation rapidly. The result is that it enabled personalized treatment regimen based on genetic profile of TB strains. And this has reduced treatment failures and cure rates, and also helped to contain the spread of multi-drug resistant TB. This is the significance. This approach exemplifies how precision medicine leverages genomics to tailor treatment, improving outcome and resource use, demonstrating the direction of global medicine, which is where it is heading to. Now, at this juncture, I must appreciate the negative team, and they brought out constructive claims about how rather precision medicine, investment in precision medicine is a luxury. And I appreciate them for their point. Number one, resource misallocation. It is important to note that it's investing or not investing in precision medicine is not an either-or decision. Investing in genomics doesn't mean abandoning basic care. No, that's not the point. But are essential for a resilient health system. And also, genome sequencing is cheaper now. Yes, it's cheaper. Cost has dropped as low as $200, and not previously as 1,000 naira as claimed. It is cost effective on the long run. Genomics reduces misdiagnosis, which I have earlier explained, and also trial and error treatments. For example, in HIV, malaria, and cancer. It improves resource use. Precision medicine prevents waste and improves outcome. Now, here's the genomics and not already exists in Africa, like the Africa Center for Ethics and Genomics Infectious Diseases in Nigeria, the HRO Africa, which is all over in 14 countries, even the ILRI, which is in Kenya, the South Africa Medical Research Council, which is in South Africa. These are various infrastructures, various bodies already in existence. Innovative solutions are working. Use of solar power labs, cloud-based platform bypass, electricity, and IT gas. Workforce development is ongoing. H3 Africa has trained over 1,000 African scientists in genomics and bioinformatics. Our early genomic investment enabled rapid detection of Ebola and COVID-19 variants. That's a quote from Professor Christian Happy. Thank you. Now, their third claim was that there's ethical priority. That's one of the claims. Okay, genomic inclusion is a matter of health. Over 95% of genomic data is from non-African population. Yet Africa has the highest genetic diversity. Direct maternal and child health benefits. Genomic also has also enabled prenatal screening, newborn genetic testing, and personalized drug therapy to reduce mortality. Now, ignoring genomic worsens this disparity. Lack of data means that Africa patients are at risk of receiving ineffective and harmful treatment. Health equity includes genomic equity. Let me take that again. Health equity includes genomic equity. This is a quote from Dr. Ambrose Workman, African Society of Human Genetics. Now, our closing statement. In conclusion, the choice is not between personalized medicine or basic care. It is between stagnation and progress. Investing in personalized genomic medicine ensures a smarter, more precise, and cost-effective healthcare system. It empowers our doctors, it informs our policies, and transforms our outcomes. Let us not fear innovation. Rather, let us embrace it for the sake of every patient whose life could be transformed by medicine and truly understands them. Thank you very much for listening. Okay, these are references. Thank you very much.